Good afternoon, and thank you for joining us for our weekly update. I'm pleased as always to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here in Peel, Sam Rogers, Mississauga's Director of Enforcement for any questions you may have about bylaw enforcement, and Darren Rizzi, our Fire Chief and Director of Emergency Management. This is an incredibly special week at the City of Mississauga. On Sunday, former Mississauga Mayor Hazel McCallion is turning 100. At General Committee today, we had the opportunity to honor her remarkable life and the contributions that she has made to our city. Throughout the week, organizations from across Mississauga will be honoring Hazel, including the Mississauga Arts Council, which has produced a tribute video that includes more than a dozen performances, as well as greetings from the Prime Minister, Justin Trudeau, and Premier Doug Ford. The video, Hazel, a celebration 100 years in the making, will be released on the Mississauga Arts Council Facebook and their YouTube channels on February 14th at 7:30 p.m. February 14th in Mississauga is also Hazel McCallion Day. I encourage everyone to tune in. At 100 years old, Hazel can look back with pride on leading a little town's transformation into the 6th largest city in Canada. I've had the privilege of building upon the foundations that she has laid along with my council. We find ourselves in a position of strength because of the over 50 years of hard work, dedication, and public service Hazel gave to the residents of this city as councillor and then mayor. On a personal note, Hazel has been a friend for many years and a mentor to me. She taught me the ropes at City Hall, encouraged me to run for mayor, and has always provided me with wise counsel and, of course, a receptive ear. She is a force of nature, which is why she's aptly called Hurricane Hazel. In the beginning, when she began her tenure as mayor, our city was mainly farmland and fruit trees. Today, Mississauga is the 6th largest city in Canada and an economic powerhouse with a quality of life that she would say is second to none. And throughout her decades of work, she helped shape the social and economic fabric of Canada for the better. Looking around the city, her fingerprints are on everything, from our booming downtown core to our burgeoning uptown communities to our commitment to economic development and attracting foreign direct investment. Hazel is everywhere, and this is why we're so proud to honor her by renaming our central library the Hazel McCallion Central Library. She has achieved so much in her life and leaves behind a lasting legacy. I am honored to call her a friend, and I wish her nothing but many, many more years of good health and, of course, happiness. On behalf of the residents of the City of Mississauga, I send my best wishes to Hazel on a very happy 100th milestone birthday. On a different note, on Monday, the province outlined the government's new regional approach to COVID-19. We learned that the majority of the province will remain under the stay-home order until February 16th, and at which time they will transition back into the color-coded framework, moving into the appropriate zones depending on their COVID trends. The province is proposing that Peel, Toronto, and York remain under the stay-at-home order until February 22nd, and then also move into the color-coded framework. The province has used the word proposes, but the final decision will be based on the COVID trends at the time. In Peel, we are anticipating moving back into the grey zone. The province also outlined changes to its color-coded framework, with the most significant being that retail businesses will be permitted to open for in-person shopping at 25% capacity, even in the grey zone. This is very good news for our small businesses. Ski hills will also be allowed to open, and libraries can once again allow residents to come inside to use computers and photocopiers. The current restrictions on construction activities will also be lifted, and while indoor gatherings and events will still be prohibited, outdoor gatherings limits will increase from 5 to 10 people. Back in December, along with the other GTHA mayors, I'd been advocating for any reopening plan that would ensure a level playing field for our small businesses. And that's why I welcome the province's approach that will allow small businesses to reopen safely. We have long known that the small businesses are not the main drivers of the virus. And I'm very hopeful that this change will help many of our small businesses begin their recovery, so after many months of stress and certainty, they can reopen their doors. I believe that the province is taking a balanced approach and a cautious approach by slowly transitioning regions back to their color-coded framework. The reality is that we are seeing case numbers steadily decline, both in Peel and across the province. Peel region is currently averaging 123 COVID cases per 100,000, and that's down from 146 just last week. Mississauga is averaging 103 cases per 100,000, almost double digits, and that's down from 119 last week. While our hospitals continue to deal with an influx of patients, the situation is slowly improving. Trillium Health Partners is currently dealing with 54 COVID patients, 11 in the ICU, and 64 suspected cases. Brampton's William Osler Hospital has 52 COVID patients, 10 in the ICU, and 42 suspected cases. In Peel, there are currently 19 long-term care homes, 11 retirement homes, and 12 group homes or assisted living facilities in active breakout. This is all very promising news. We are making real progress in Mississauga, in Ontario, and across the country. And health experts are all attributing this steady decline to the fact that the vast majority of Canadians, the vast majority of Ontarians, and of course the vast majority of Mississaugans are listening to the advice of public health. I want to again thank everyone for playing their part. We wouldn't be in this situation if it wasn't for the huge sacrifices that you have already made. But I want to make one thing clear. There are new and real threats still lurking. As we begin to open up, we're also moving into a very different phase of this pandemic. Last Friday, Dr. Lowe reported that we had 5 confirmed cases of variants of concerns, different variants of the virus. By yesterday, we had more than quadrupled that number with 23 cases of different variants. Perhaps most troubling is that 60 more cases have been screened as possible variants of concern, with public health still awaiting results of their follow-up testing. We know that these new variants are more transmissible and that they have the potential to undo all the hard work that we all have put in. Yes, the number or variant cases are relatively low compared to our overall case count. But what's so concerning is the rapid increase in these numbers, and they have been climbing while we've been under the stay-at-home order. When we do reopen, we have to be incredibly cautious, and our priorities haven't changed, and that's protecting our long-term care homes, our vulnerable residents inside those homes, and ensuring that our hospitals have capacity to respond to the needs of all our residents. It's also so important then when businesses are to reopen, that they stay open and not have to close and reopen once again. I've talked to many small business owners over the last year, and I've been told that the hardest thing for them is ramping up for a reopening and then having to quickly close up once again. What happens over the next few weeks will be critical in all of this, particularly the kids across Peel going back to school next week. We know that any increased contact will inevitably lead to new cases. And if we are to open businesses on the 22nd, we will be doing so without knowing the full impact of the school reopening. That's why over the coming weeks, it is imperative that everyone remains vigilant and continues listening to the advice of public health. I am encouraged by the fact that the new provincial plan includes what's being called an emergency brake, and that will allow the province to immediately move any region into lockdown if there's a rapid acceleration or escalation of COVID cases. I encourage the province to use the emergency brake if cases begin to move back into the wrong direction. The reality is that we are now in a race between these new variants and the vaccine. We all know that there have been significant issues in Canada receiving the doses that we had initially expected. I was on a call yesterday with General Rick Hillier, who is heading the province's COVID-19 task force, and he was pretty blunt about the situation, saying that we are in a vaccine drought. Over the last 2 weeks, Ontario has only received 26,000 doses of the Pfizer vaccine. This week, Ontario is receiving 27,000 doses of the Pfizer vaccine and 63,000 doses of the Moderna vaccine. Thankfully, things will begin to ramp up next week, with the province anticipating 140,000 Pfizer doses and then also 140 or 150,000 every week until the end of the year. General Hillier confirmed that the priority remains to first get the province's frontline healthcare workers and long-term residents vaccinated. Once that's complete, the province will begin transitioning into the next phase of the vaccine rollout, first focusing on retirement homes and then residents 80 years old and older. It was also encouraging to hear that the federal government is confident that Canada is still on track to receive tens of millions of vaccines throughout the spring, and that everyone who wants to be vaccinated will be vaccinated by September of this year. There was also news this week that more vaccine candidates are currently in the approval process with Health Canada. Along with Mayor Brown of Brampton and Mayor Thompson of Caledon, who's celebrating a birthday today, happy birthday, Alan, I will continue to advocate to the province that Peel Region continues to be prioritized as we receive more shipments of the vaccine. While cases are going down, Peel Region remains one of the hardest hit regions in Canada. At the City, we are preparing over the next week and a half to move into the grey zone. I encourage all businesses and residents to familiarize themselves with the updated provincial regulations. For now, I again urge everyone to continue following the stay-at-home measures. Doing so gives us the best chance at ensuring that once we do open, we will remain open and then begin to see even broader reopenings. Before I bring up Dr. Lowe, I want to quickly talk about keeping safe while enjoying outdoor activities. Over the weekend, 2 people went through the ice on the Credit River and required emergency services to respond. While I'm a huge supporter of everybody getting outside for physical activity, our rivers, ponds, and lakes pose real danger. We have ordered signs to be placed at key locations to educate residents of the dangers of doing this. But I also want to remind everyone that our large outdoor rinks are open, along with our 37 natural rinks that are maintained by community volunteers. These are much, much safer than skating on bodies of water. Please visit the City's website to book a time slot for our 3 larger rinks or to see the locations of all our natural rinks. Be safe and be well, Mississaugans. And now I'd like to invite Dr. Lowe up to give his update.
Thank you, Madam Mayor, and good afternoon. Mississauga's test positivity for COVID-19 currently sits at 5.7% this week, which is down from 7% last week and the weekly incidence rate is at 103.1 cases per 100,000, down from 119 per 100,000 cases last week. While I am hopeful that our trends will remain favorable, I know that our hospitals still continue to contend with significant challenges. The arrival of variants in our community also reminds me, as we have seen time and time again throughout this pandemic, that our choices matter. Our schools will resume in-person learning after Family Day. With our school board partners and Ontario Health, the provincial agency that leads testing, we are putting in place the same precautions that kept schools open through the fall and enhancing them with additional testing, which will also include additional pop-up testing locations in the coming days at select schools and community sites to increase access for students, staff, and their families ahead of their return to in-person learning next week. My support for school reopening was based on current transmission patterns that suggests the benefit of having children back in class for their learning, their socialization, their well-being and development currently outweighs the risks of COVID-19, which can be further mitigated through the precautionary measures that are being put in place. However, my support for school reopening was also based on a recommendation that other public health measures remain in place for at least 2 weeks after reopening, through the end of February, to observe any changes and impacts in interactions. Especially with variants of concern in our community, we must move cautiously as the large community that will open up around our schools will begin to interact differently. Earlier this week, our provincial counterparts announced a return to the color-coded regional framework. And while most of the regions in the province will return to the framework next week, Peel is one of 3 health units that is anticipated to return on February 22nd. Leaving aside the fact that this comes just 6 days after school reopening and a little too soon to fully determine the impact of school reopening, the framework itself has also been amended to permit a limited reopening of certain sectors across all color categories, including in the grey lockdown category. That goes against the advice that I had provided to make one big change, reopen schools, and then observe the effects. Regardless of what happens, we must move gradually. There are variants in our midst which have the potential to reverse everything that we have all worked hard and sacrificed so much for. And we know how this story goes. In November, we were at the same daily average new cases as we are now, 280. And over 2 weeks, in the fall, that increased 50% to 420. That was just 2 weeks, and that was without variants that are more transmissible and with the community that was not under a stay-at-home order. So I must be clear, as decisions around reopening are taken, that rapidly reopening is not a formula for success. It is a formula for a third wave. And I want to be clear, I say that in feeling for our business owners. I know that a third shutdown to save lives would permanently destroy livelihoods in our community, and nobody would want to see that. A winning strategy that we can all ascribe to is to hold on to the measures we have taken for just a little longer, individually. Get the kids back in school, get more vaccines, and chase the warmer weather of spring. I know that this has been hard and that we are all tired, but in this case, a stitch in time can save 9. We've come so far, and what we do with these next few weeks as schools reopen could mean the difference between months more of agony versus a successful vaccination ramp-up, economic reopening with confidence, and an exit from this nightmare. No matter what gets decided, please remember my advice. Do your part to stay home as much as possible, stay safe, and make it through this next hump. Thank you, and I'll pass it back to Madam Mayor.
Thank you for your update, Dr. Lowe. And now, Dr. Lowe, myself, Sam Rogers, and Chief Rizzi are able to take your questions. Welcome your questions.
Your first question comes from Beatrice Vaisman at CP24. Go ahead, Beatrice.
Good afternoon. Mayor Crombie, this question is for you. We know that the Ministry of Labour is ramping up inspections, specifically this time targeting warehouses and distribution centers. Certainly these kinds of workplaces have been hit hard extraordinarily in Peel Region specifically. What do you make of this initiative, and how do you think it's actually going to help Peel Region, the city of Mississauga, combat COVID-19?
Well, I encourage the initiative, as a matter of fact. I think it's great news and we welcome it here. I know that public health has also take precautionary measures and go out and inspect our workplaces, including our manufacturing sites, our food processing sites, our warehouses, etc. I know that many of them are moving towards rapid testing, and we encourage that as well. That way we know each shift that goes in is safe, and that we have to ensure that all the proper protocols are in place and being used. So we welcome this initiative, and I know Dr. Lowe is nodding here next to me. He welcomes it as well, and don't know if you would like him to make a few comments about it either. Beatrice? Did we lose Beatrice? Why don't you come in?
Well, if he's willing.
Yes, of course he is.
Follow-up? Sorry.
You know, he's got, Dr. Lowe will make a comment, and then we'll have the follow-up.
Yeah, thanks so much, Beatrice, for the question. I think certainly the story of Peel and the ongoing transmission in essential workplaces that were not impacted by the stay-at-home and the provincial shutdown has been really spoken about both in my own public representations and certainly supported by our area mayors and regional council in their push for paid sick days and better protections for our frontline workers. And so certainly it is a welcome announcement. Of course, the devil is in the details, and to the extent that Peel Public Health has long been disclosing data about the most impacted sectors, the sectors that are seeing the highest risk and transmission in our community, we will continue our conversations with our Ministry of Labour partners to ensure that this initiative bears fruit in continuing amongst the suite of preventive measures to bring COVID-19 under control in our community. Thanks for the question.
Is there a follow-up, Beatrice?
There is, and it is for Dr. Lowe.
Okay, no problem. Thank you.
Go ahead with your question, Beatrice.
Doctor, this is a story first reported by the Toronto Star. We just got a comment from your office as well about two teachers at a Brampton high school, at least one of whom has now tested positive for the UK variant after they went to the school to work out. What do you know about this?
Yeah, so I can confirm that we have just concluded an investigation into a situation at a specific high school in Brampton. It's important to note that the school was closed to general in-person learning at the time that the exposure occurred. And from our investigation, we have identified that no one else was exposed and that the outbreak has been declared over. Individuals are safely self-isolating. So certainly, at least as it pertains to plans to reopen schools next week, that school, for the purpose of our investigation, is at this point in time not currently an outbreak. Thanks very much for the question.
Next question, please.
Your next question comes from Sabrina Jonas at CBC News. Go ahead, Sabrina.
Welcome, Sabrina.
Hi, thank you. Hi, Mayor. Thanks for taking my question. Just going back to the Ministry of Labour's announcement today, targeting 100 distribution centres like warehouses in the Peel region. Has the city, sorry, I know you touched on this a bit earlier, but has the city seen COVID-19 compliance being a big problem in these facilities? And is the city, going to try to implement any additional protocols?
Workplace, okay. Yeah, so we know that the majority of our spread has been community spread, but certainly workplace outbreaks. We've seen a majority of outbreaks in warehouses, food processing plants, manufacturing sites. And so I know that Dr. Lowe and his team at Public Health have been proactively inspecting these sites as well. So we welcome the blitz that will be done by the Ministry of Labour and ensuring that the proper protocols and workplace practices are in place. And I'm hopeful hopeful that they will be encouraged as well to use rapid testing to ensure that each shift going in will be safe. And I know that at least when there is a workplace outbreak, it is quite easy to isolate, clean, and send everyone home who has been exposed, and that way they can self-isolate. And the one plea, as Dr. Lowe had mentioned earlier, is that we still are hopeful that the federal and the provincial government will work together and offer paid sick leave or paid sick days to those employees. Dr. Lowe, would you like to comment on this further, please?
Yes, thank you, Madam Mayor. Thank you, Sabrina, for the question. Certainly in the course of our outbreak investigations, Peel Public Health does go into workplaces to conduct infection prevention and control compliance checks. It's through our work as well as the work of our case and contact managers and outbreak investigators that we have consistently been able to identify highest risk economic sectors in our region, certainly warehouses, distribution, food processing, manufacturing. These are the jobs that can't be done from home and that were deemed essential throughout all of the recent closures and shutdowns. And so to the extent that Peel Public Health has been really highlighting the need for inspections, investigations, and protections, I'm hopeful that this blitz will really help to bring employers into compliance and take steps to protect our workers who are often precariously employed, many temporary contract workers, individuals who are working and for whom, if precautions aren't being taken, there is a noted higher risk of COVID-19 transmission. Thanks very much for the question.
Follow-up?
No, thank you so much, you both, for your response.
Thank you for your question. Next question, please.
Your next question is actually for Dr. Lowe, both questions.
Okay, terrific, Dr. Lowe. Just let me get my mask back. Thank you.
Comes from Isaac Allen at the Pointer.
Hi, Isaac.
Hi, Dr. Lowe. How are you?
Good, how are you?
I'm good, thanks. I want to ask you a little bit about the variants, just to understand how much we should be reading into the results that we're getting. You know, Mayor Crombie talked about the rate at which they'd increased, and since you're not testing every test result for the variants, are you able to give me an idea of the positivity rate of the variants, as it were? So what percentage of the tests that you send off to check for variants are coming back with those variants included? And do we know what rate they're spreading at? Like, what is the logic by which tests are sent off and when they're not?
So, Isaac, I would suggest that you direct this question to Public Health Ontario and the Provincial Laboratory, as they are the ones that oversee testing. Our requests for variants typically focuses on when we identify an outbreak that seems unusual, but I do know that Public Health Ontario have implemented some processes where I believe every positive test sample now gets screened, and then if a variant is identified through the screening, it is then sequenced using whole genome sequencing. But the extent and the data to which they have out of that whole process, I don't have access to, so you would be best to chat with Public Health Ontario.
Follow-up?
Yeah, okay, I'll do that, thank you. My follow-up is that you were, in your remarks at the beginning, it sounded like you were pushing back a little on the province's decision, particularly the timelines of appeal when it comes to reopening and schools, and I just want to really get you on the record here. Are you opposed to the reopening framework for Peel as it stands with the current dates?
Well, thanks very much, Isaac, for the question. I think certainly we recognize that the province has made its decisions, and to the extent that our planning assumption had been that we would be returning to the framework as it stood before the holiday reopening, I think we are still studying the impact, at least that has been identified. But we do know a truism throughout this entire pandemic has been the more you open up within the community, there is an increase in contact and an increase in interactions. I would say certainly we are very close to hopefully wider spread vaccine distribution, which I think the best way to say it is we're just having seen Super Bowl. We're literally at third and goal here, fourth and goal, and trying to get into the end zone. I think it's all in the choices we make right now, and there is really limited room for error, at least in the timing at this point in time. So that's why in my remarks, I think I've really appealed to our residents, who I know have stepped up in a big way, that regardless of what decisions are taken, I think we in Peel, especially with the transmission rates that we see here, especially with the variants that we see here, we need to continue doing our best to stay home, to avoid interacting with people outside of our homes, at least for the time being. And once the vaccines come, allow that to really change the landscape in our community. Thanks for the question.
Thank you, Isaac. Next question, please.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Hey, Mayor Crombie, how are you?
I'm so well today, thank you. Had a good morning with Hazel.
Yeah, I was watching. I'd seen a release earlier in the week from MBOT and Mississauga's BIA's a joint statement asking for yourself and council to consider a property tax freeze for both the city and the region. Just curious about your thoughts on that. I know it's the city or city council in Mississauga, let's say in principle, is kind of set at around a 1% tax increase for this year, but is it possible to go lower, and what would be the consequences of something like that?
So it's actually 0.9%. It's under 1% as you describe. And you know that we have union contracts to honor that are at 2% or close to 2% increases. And it's about 65% of my costs each year. And we continue to be committed to putting 2% away for interest and debt repayment. And so those are very important principles for us because we have to continue to put away money for our capital infrastructure as well and debt repayment. So that's why we've been able to bring it down to 0.9%. We've eliminated all discretionary spending and, deferred any project we could and delayed, and there's a hiring freeze, etc. So we've done what we can, but we think 0.9 is about as low as we can go at the city. Now, we haven't passed that budget yet, Steve, as you know, so it will be coming back for further discussion. We wanted to see what the the result at the region of Peel would be, and we're finalizing the budget tomorrow. The impact on the city's budget should be about 1.3%, so for a total of about 2.3. So that's what we're looking at, but it's not finalized yet. There is still some discussion ongoing whether we put the 1% debt repayment infrastructure levy away for this year at the region of Peel. So that discussion will be had tomorrow. I know you will be watching. We've done whatever we could, sharpen our pencils and bring it down as low as we can, but we do have some obligations, and we do want to continue to invest in our city, particularly into our capital infrastructure, and of course then the other union and labor commitments.
Follow-up?
Thanks, Mayor Crombie. My follow-up, I believe, is for Dr. Lowe.
Certainly, Steve. Dr. Lowe?
Thanks, Steve. Go ahead with your question.
Dr. Lowe, just following up kind of on what Isaac was discussing, it sounded like there was some hesitancy in your earlier comments about kind of whether or not Peel would be ready without that buffer between school reopening and the end of the stay-at-home order. So I'm just hoping to clarify here, if the numbers don't kind of improve and it doesn't necessarily look like Peel is ready to have a broader reopening on February 22nd, what are your recommendations? Are people to kind of continue the stay-at-home order in an unofficial way? What exactly are you asking people to do?
Thanks, Steve, for the opportunity to clarify. We still continue to have the highest incidence rate of COVID-19 transmission in the province. Now, granted, we have seen 4 full weeks of a decline. And certainly I'm hopeful that, with school reopening and that segment of the community opening up, and then the anticipated opening of other sectors in a return to the provincial coded framework on February 22nd, we're going to need to watch very carefully what happens, provided that there isn't any change in the timeline or whatever the case might be, which is why my message to residents, though, is the same. Whatever's open, whatever's closed, nothing has really changed materially about the extent of COVID transmission we have in our community. We have a lot of, we have more and more variants being detected, and we have not that much vaccine. And ideally, we would want to have a broad reopening where the situation is reversed. So I think to the extent that it will be on all of our hands to continue to keep each other safe, to ensure that we prevent a third wave, that we keep our business owners from having to experience another shutdown. It will be really in those 3 to 4 weeks after these dual reopenings that are taking place in the middle of February to really see what will happen. And I do recognize that the province has said it is not a reopening, and I think that message is really important. This is not a wide, everything's back to normal. I think I would echo that as well. The last thing I'll say, Steve, is when I was in medical school and treating patients, we learned a treatment phrase and philosophy, which is you start low and you go slow. That's what you do with you start any new drug. You basically start really low and then you try to up it slowly rather than just going full bore. I think that really applies to our situation as well. And to the extent that I know the province is very busy balancing different, not busy, but very challenged balancing so many different competing considerations from health, from the economy, all these other pieces. I'm certain that they are also hoping to make sure that this gradually reopens to get us to a point where we can still make sure that levels are low enough that our vaccinations will succeed, that our hospitals aren't dealing with a third wave, we can still vaccinate people, and then hopefully reopen with confidence. I think we certainly share that same goal. Thanks very much for the question.
Next question, please.
Your next question comes from Ashley Newport at Mississauga. Go ahead, Ashley.
Hi, Mayor Crombie.
Welcome, Ashley.
Thank you. I wanted to follow up on something that you mentioned about a little over a month ago now. You said that one thing that the city was seeing was this emergence of speakeasy type places in industrial areas. I just wanted to find out if this is still a problem in Mississauga, if this is something that's still happening, and if it is still happening, what are some of the challenges in shutting down these places? Do you have to rely on reports, or is the city actively patrolling, looking towards these? And how does, I guess, enforcement and shutdown of these kind of speakeasy type places, how it's happening?
A great question, Ashley, and I am going to bring up Sam Rogers shortly. So we have been ticketing those speakeasy late night gatherings, shall we call them, in commercial settings for the past number of months. And there was one ticket given out on Saturday, February 6th in a commercial spot. So we have been seeing them, although I will suggest to you less so. They were getting less and less frequent. I think the word has been getting out that should they be found out by bylaw, they will be ticketed. This is something we take very seriously. So why don't I ask Sam Rogers to come in and speak to you directly about their efforts to ticket these so-called late night speakeasies where they see gatherings of large groups of men, often gambling, sometimes alcohol, and unusually hookah or shisha as well. Sam?
Hi, Ashley, and thanks very much for the question. Just to add on to what Mayor Crombie was saying, we have seen a downward trend on these private gatherings in commercial spaces, colloquially known as speakeasies. We've done an awful lot to really snuff out this activity for these, quite frankly, egregious violations. I can give you some numbers here. From November 24th through to January 6th, we saw 10 occurrences in 8 different locations, and we laid a total of 105 charges. And we've seen that trend go down from January 6th until the present. We've seen only 6 occurrences, 6 locations, and 2 of them were new. We've laid a total of 34 charges. So we are actively surveilling these locations. We have issued some temporary notices of closure for a 24-hour period under the emergency management orders, and they're really drying up. So we're staying on top of it. We've laid, as I said, a total of 139 charges, and we're seeing the operations slowly peter out. We'll continue to monitor and enforce under the new restrictions moving forward as well. Thank you.
Follow-up?
Thank you. And my next question, I'm not sure if Dr. Lowe might want to weigh in on it as well. But I wanted to ask about isolation centers. I know Peel's had some for a short while now, and I wanted to know if they're making a difference in Mississauga in terms of household outbreak, because I know we've talked a lot about workplace outbreaks being huge, and then after that, household outbreaks were also contributing to quite a bit of virus transmission for quite some time. Are these isolation centers being utilized well? Are they making a dent in in household spread?
Very good question. I will say that we had a new one open up 2 weeks ago in south part of Mississauga. There was the original isolation center near Dairy Road in Mississauga that also served Brampton, and that has been open for some time. The last time I checked, the uptake on them had been quite low when you take the total occupancy versus the number of overall rooms that are available. It seemed about 25%, but perhaps those numbers have turned around, and maybe Dr. Lowe has some more updated figures. So Ashley, I'm going to ask Dr. Lowe to come in and respond to the balance of the question. Okay?
Yeah. Thanks so much, Madam Mayor, and thanks, Ashley, for the question. No, Mayor Crombie got the proportions right. It is sitting around 25 to 30%, but that's simply because we have brought on so much capacity in such a short little time. Certainly the numbers we're getting now, we have, and I would encourage you to reach out to our communications colleagues for the exact numbers, but I know that we had dozens of individuals who were referred to the center, to the system rather, because there's a number of centers, over the last week, and the numbers on a week-by-week basis continue to increase. That is basically people who are awaiting test results, people who've been exposed, people who may be sick with COVID, who are not at home, potentially exposing people and who are now safely self-isolating in the host. So I imagine in a hotel facility. So I imagine you will start to see this contribution. And again, COVID-19 is a big puzzle, and there's lots of different pieces in terms of trying to break the chains of transmission. This is going to make a difference when it comes to household transmission. And one other thing just around the numbers specifically. First of all, we do know that the numbers are also influenced by the fact that the only people we're referring at this point in time are people who are unable to safely self-isolate at home. Many people do live in homes where they can safely self-isolate, but those that cannot, they are receiving priority for this shelter and to really stop spread in that case. And like I said, the other thing is we've just brought on a whole bunch of capacity, and week on week we've been continuing to see more and more people avail themselves of this service. So there's lots more information online. I certainly encourage anyone who is awaiting a test result, who's not feeling well, who wishes to be assessed for referral to the center because they can't safely self-isolate, please reach out to Peel Public Health. Thank you very much.
Thank you. Any further questions?
Your last question comes from Khalid Salama at My Second Home TV. Go ahead, Khalid.
Thank you. Hi, Mayor Crombie. How are you?
Welcome, Khalid. Nice to hear your voice again.
Well, nice. Same here. Thank you. Mayor, there was a news report speaking about some losses for TTC amounted for around $67 million and lost revenue. That was in 2019. That's because, of course, they lost it to Uber and Lyft and other air riding platforms. How is it here in Mississauga when it comes to Mississauga transit?
Khalid, thank you for the question. So we had been losing during the height of COVID when we were operating free public transit about $7.5 million a month. And we thought that our transit ridership would recover and we would see our riders increasing weekly. And towards the end of the year, we were quite hopeful we would see 50, 60, 75% capacity return. But unfortunately, the uptake has been slow and we're still at between 40 and 50% capacity on many of our lines. So I will share with you that I think the impact is more so COVID related than the impact from our ride sharing companies, because we have been working in collaboration with ride sharing companies for first mile and last mile to our transit stations for many years now.
I see. Thank you. And my follow-up will be for Dr. Lowe, please.
Thank you.
Thank you.
Thanks, Khalid. Go ahead with your question.
Thank you. Dr. Lowe, there was recently agreement between Canada and Pfizer in regards of the 5 or 6 doses per vial. And how is it here, especially that to utilize the most, to get the 6 doses, we have to have special syringes, and I believe we counter shortages in this field. How you elaborate on that, sir?
Absolutely. So thank you for the question. As you know, there's been this debate, and especially for those that have been involved in immunizing with the Pfizer product, there is often a sixth dose in the vial. And as you can imagine, if you're dealing with milliliters, there's always this challenge of filling it to the exact of 5 or 6. And they've discovered that you're able to obtain it with a specific type of syringe, which really reduces the amount of airspace that is in the tip. My understanding from our hospital partners is that we have very experienced immunizers who are very good at getting that sixth dose out of here, out of those vials, and really multiplying that. However, it is important to mention that at this time, overall vaccine supply still remains limited. It's tough to get 5 or 6 doses out of vials that aren't in our community at this point in time, and I am hopeful that the federal government will resolve its situation with Pfizer to ensure that the TAP 4 doses will start flowing again soon, so that we can put our experienced immunizers to work at getting 6 doses out of a vial, whatever the case might be. Thanks very much for the question, Khalid.
Are there any further questions?
That concludes our press conference for today. Thank you for joining.
Thank you.